Bismillahirrahmanirrahim. Quote for the day is, but perhaps you hate a thing and it is good for you, and perhaps you love a thing and it is bad for you, and Allah knows while you know not. The topic of today's presentation is cancer. I am Dr. Ayesha Amin, PGR of Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of Professor Dr. Saira Afzal. The learning outlines for today's presentations are global pattern of the cancers, risk factor, prevention, screening, breast cancer, cervical cancer, lung cancer, recent updates in cancer, and the multiple choice questions at the end. Learning outcomes. At the end of the presentations, the participants will be able to describe the risk factors, screening, and the prevention of common type of cancers, and to be able to answer the MCQs. So what is basically cancer? A cancer is a large group of diseases that can start in almost any organ or tissue of the body when abnormal cells grows uncontrollably, go beyond their usual boundaries to invade the adjoining parts of the body and spread to other organs. Problem statement. According to the Globocane 2022 data, in 2022, there were an estimated 20 million new cancer cases and 9.7 million deaths due to cancer. The estimated number of people who are alive within 5 years following a cancer diagnosis was 53.5 million. About 1 in 5 people develop cancer in their lifetime. Approximately 1 in 9 men and 1 in 12 women die from the disease. Global cancer patterns. The lung cancer is the most commonly occurring cancer worldwide, with 2.5 million new cases accounting for 12.4% of the total new cases, followed by the female breast cancer, which is ranked at the second position with about 2.3 million cases. Then there comes the colorectal cancers with 1.9 million cases, followed by prostate and stomach cancers. The diagram on the left side, this pie chart, it shows the absolute incidence of cancer according to the Globocane 2022 data in both the sexes. The most common type of cancer is lung cancer, and it is then followed by the breast cancer and colorectal cancer. As far as the mortality is concerned with the cancers in both the sexes, the leading cause of death due to the cancer is lung cancer, followed by the colorectal cancer, then by liver and breast cancers. The most common type of cancer incidence by Globocane 2022. The upper part of the figure, it shows the most common site of cancers occurring in male. The green color shows the cancers of prostate. The blue color shows the cancers of the lung. While in females, the most common type of cancers occurring are breast cancers, which are shown by pink color, and the cervical cancers, which are shown by orange color. The cancers which are causing most common cancers which are leading to death in males, they are lung cancers, followed by the prostate and liver cancers, as we have already discussed. While in female, the most common type of cancers which are leading to death are breast cancer, and then cervical, and then lung cancers. So incidence burdens of the major cancer in Pakistan, according to the Globocane 2022 data, the data on the left side shows that the most common type of cancer occurring in male is oral and oral cavity and the lip cancers, followed by lung cancer, and then colorectal and prostate cancers. And in female, the most common type of cancers occurring are breast cancer, followed by the lip and oral cavity cancers, and then ovarian and cervical cancer. We have seen that over the years, the lip and oral cavity cancers have got much attention, and there are increased number of these type of cancer patients. So coming to the risk factors of the cancers, there are certain biomedical, lifestyle factors, and environmental factors. So for the biomedical factors, there is a genetic susceptibility to cancers, or there may be hormonal factors in female, such as for the carcinomas of breast, ovarian and endometrial carcinomas. The lifestyle factors which can lead to carcinomas are smoking, alcohol consumptions, physical inactivity, obesity, chronic infections, and unhealthy diet. The environmental factors, sunlight, which mostly leads to skin or cancers, then radiation, occupational exposure, which can lead to the lung cancers, and pollution. So for prevention of the cancers, the primary level of prevention includes health promotion, which includes personal hygiene, diet, which is enriched in fruits and vegetables, control of tobacco and alcohol consumption, food, drug, and cosmetics. They should be tested for carcinogens, radiation. The special efforts should be made to reduce the amount of radiation, including the medical radiation received by each individual to a minimum without reducing the benefits. Occupational exposure. The occupational aspects of the cancer are frequently neglected. Measures to protect the workers from exposure to industrial carcinogens should be enforced in industries. Air pollution. Control of air pollution is an other preventive measure. For health education, there should be legislations to control the known environmental carcinogens, that is tobacco, alcohol, and air pollution. Cancer education, to make people aware about the risk factor of the cancers and to motivate people to seek early diagnosis and treatment. And then specific protections. There are certain cancers for which immunization is present. For example, for the prevention of cervical cancer, immunization against human papillomavirus should be encouraged. For secondary prevention, there is early detection of cases and prompt treatment. The early detection of cases include cancer screening, which is the main weapon for early detection of cancers at a pre-invasive, that is in situ or pre-malignant stage. For prompt treatment, we know that there are different type of cancer treatment modalities are present, from surgery to radiation therapy, chemotherapy, immunotherapy, hormonal therapy, targeted therapy, and stem cell therapy. So for screening of the cancer, what is cancer screening? Cancer screening is defined as the search of unrecognized malignancy by means of rapidly applied test. The U.S. Preventive Task Force and the American Cancer Society are the two organizations that widely issue cancer guidelines. So there are cancers for which screening is recommended for average risk population. It includes the breast, cervical, and prostate cancers, while there are cancers for which screening is recommended in high risk population. It includes colorectal, lung, and liver carcinomas. Types of screening. The cancer screening is basically divided into two parts, that is mass screening or high risk or selective screening. In mass screening, whole of the population or community is screened irrespective of the risk, while in high risk or selective screening, it is selectively applied to the people who are high risk, and it is cost effective. The SEER program, it is basically a surveillance epidemiology and end result program of the National Cancer Institute, which is an authoritative source of information on cancer incidence and survival in the United States. SEER currently collects and publishes cancer incidence and survival data from population-based registries covering approximately 48% of the US population. The SEER program registries routinely collect data on patient demographies, primary tumor site, tumor morphology, and stage at diagnosis, first course of treatment, and follow-up for vital status. The SEER program is the only comprehensive source of population-based information in the United States that include the stage of cancer at the time of diagnosis and patient survival data. So what are cancer registries? They are the source of providing necessary information about the patient. There are different types of cancer registries. Number one is population-based registries. They record all cases in a defined population, most frequently a geographical area such as a state or metropolitan area, with an emphasis on the use of data for epidemiology, the science which is used to find the cause of health outcome and disease in population. Population-based registries are designed to determine the cancer patterns among various population or subpopulations, monitor cancer trends over time, guide planning and evaluation of cancer control efforts, help prioritize health resource allocations, advances in clinical, epidemiological, and health service research. Cancer surveillance programs such as the SEER program, which we have discussed earlier, use the cancer statistics collected by the population-based registries to monitor the distribution of cancer cases by sex, race, ethnicity, age, and other demographic factors. The other type of registries are hospital-based registries, which include all patients which are treated by a particular institution, whether inpatient or outpatient. Registry should collect the uniform minimum set of data recommended in the WHO handbook for standardized cancer registries. If there is a long-term follow-up of patients, hospital-based registries can be considerable value in the evaluation of diagnostic and treatment programs. Then there are special cancer registries which collect and maintain data on particular type of cancers. These registries often provide informational opportunities for those who want to learn more about specific cancer type and support for those who may suffer from it. Coming to the most common type of cancers in the female, that is breast cancer. Female breast cancer is the most commonly diagnosed cancer, that is 11.5% of the total cases globally, according to the Globocane 2022. It is the most common cause of death among cancers in female. So there are certain risk factors for cancer which are divided into the non-modifiable and modifiable risk factor. The non-modifiable risk factors are female gender, age greater than 45 years of age, if there is genetic mutations of BRCA genes, if there is a family history of breast cancer, there is a personal history of breast cancer, race or ethnicity, dense breast tissue, certain benign conditions, or lobular carcinoma in situ, menstrual abnormalities such as early menarche or late menopause, previous chest radiation, or diethylstilbestrol exposure. While in modifiable risk factor, we have nulliparity, use of oral contraceptive pills and Depo-Provera, hormone therapy after menopause, breastfeeding, alcohol consumption, obesity, and decreased physical exercise. Sign and symptoms of the disease. So breast cancer, it can appear as a swelling or lump in the breast, swelling in the armpit, persistent breast tenderness or pain. There can be nipple discharge or nipple pain with changes in the nipple forms. For the diagnosis of breast cancer, triple test approach is used, that is clinical examination, which is based on history, and inspection and palpation. Then there comes the breast imaging, which includes mammography, breast and axillary ultrasounds, and breast magnetic resonance imaging. And in the end, there are cold needle biopsies for suspicious lesions. For treatment of breast cancers, we have different options such as surgery, which include mastectomy and modified radical mastectomy, the targeted therapy, radiation therapy, chemotherapy, and then hormonal therapy. For prevention of breast cancer, you may need to breastfeed your kid, don't smoke, limit using hormonal medication, limit exposure to the pollution, limit your alcohol consumption, go for a mammogram, watch for the changes in your breast, eat healthy food, keep your weight down, exercise regularly. Screening for the breast cancer. The American Cancer Society, it strongly recommends this cancer screening for early detection of breast cancer. These are the guidelines for the women who are at the average risk of breast cancer. So for the women who are between the 40 to 44 years of age, they should have the option to start screening with a mammogram every year. Women with 45 to 54 years of age should get a mammogram every year, while women with who age 55 and older, they can switch to a mammogram every other year, or they can choose to continue yearly mammograms. Screening should continue as long as the woman is in good health and is expected to live at least 10 more years. For women who are at the high risk of breast cancer based on certain factors, such as women who have the genetic tendency for breast cancer and who have the genetic mutations of the BRCA genes, they should get a mammogram every year, typically starting at the 30 years of age. As we all know that October is celebrated as Breast Cancer Awareness Month globally. So let's be aware, you have a good chance to cure breast cancer if you find and treat it early. If you think something is wrong, don't wait, seek care immediately. Coming to the second most common cancer in the females is cervical cancer. So every year, around 5,008 women are diagnosed with cervical cancer and 3,197 die from the disease. The cervical cancer ranked as the third most frequent cancer among women in Pakistan and second most frequent cancer among women between 15 to 44 years of age. About 0.5% of women in the general population are estimated to harbor the cervical human papilloma virus 16 and 18 infection at a given time, and 88.1% of the invasive cervical carcinomas are attributed to the HPV infection. So for the risk factor of cervical cancer, the main risk factor for the cervical cancer is due to the infection of human papillomavirus, and the most common strain is 16 and 18. Then multiple sexual partner, early sexual activity, weakened immune system, smoking, long-term use of birth control pills, history of STDs, family history of cervical cancer, socioeconomic factors, and again the diethyl stilbestrol exposure. So, what are the signs and symptoms of cervical cancer? It can begin with the fatigue, unexplained weight loss, heavy vaginal bleeding, postcoital bleed, intermenstrual bleed. Rarely there is a presence of vaginal mass. There can be bleeding after pelvic examination, pain in legs and back. There is lack of appetite and pain in pelvis. So for the diagnosis of cervical cancer, certain modalities are used. That is colposcopy. A colposcopy is a magnifying device to examine the cervix for abnormal cell. Then there is an option for biopsy, which removes a small sample of tissue from the cervix for laboratory analysis. And then imaging testing, which includes the CT and MRI. So for the treatment of the cervical cancer, we have the options for surgery, radiation, targeted therapy, immunotherapy, and chemotherapy. So what are the preventive measures which can be applied to prevent the cervical carcinoma is first you need to get vaccinated against HPV, practice safe sex, undergo regular pap smears, quit smoking, maintain a healthy lifestyle, and stay informed and educated. These are screening guidelines as per the American College of Obstetrician and Gynecology. So it states that if you are younger than 21 years, you do not need screening for HPV. But if you are between the age of 21 to 29, you should have a pap smear done almost every 3 years. HPV testing alone can be considered for women who are 25 to 29, but pap smears are preferred. And if you are between the 30 to 65 years of age, you can choose one of three options. You can have a pap smear test and HPV test every 5 years, have a pap smear test every 3 years, or have an HPV test alone every 5 years. If you are 65 years or older, you do not need screening. If you have no history of cervical changes, and either three negative pap smear results are present in a row. Remember, you still need to have screening if you have been vaccinated against HPV, and you still need to have screening if you had a hysterectomy and your cervix was not removed. What are well women clinics? The primary and secondary healthcare department of the government of Punjab have launched the Prevention and Control of Non-Communicable Diseases program in 2016 to mobilize the provincial final resources required for the implementation of NCD screening, awareness, and continuity of care interventions in its fourth revision, which was taken place on 3rd September 2021. It was revised and a few components are added into it, which includes the mental health component, which includes depression and anxiety, type 1 diabetes, diabetes in pregnancy, and screening of complications which are associated with diabetes. Along with this, there were 130 more service delivery points with the name of Well Women Clinics were established, and they are operating at THQs and DHQ level for the screening of CA breast and cervical cancer. This chart basically shows that at the level of BHUs, the clinical breast examination by the physician is encouraged, and at the level of THQs and DHQs, there is at the level of THQs there is VIA, that is visual inspection of cervix via acetic acid for cervical cancer screening is used, and at the level of DHQs mammograms are being offered and pap smears. As we all know, that cervical cancer can be prevented with the help of vaccination. The recommended schedule for the vaccination for children 11 to 12 years is that only two doses are needed if the first dose was given before 15th birthday. So first dose is given between 11 to 12 years of age. You can start it at as early as it at the age of 9, and the second dose is given at 6 to 12 months apart after the first dose. For children 9 to 14 years of age, if you have received two doses of HPV vaccine, which are less than 5 months apart, so you can need a third dose. People who are 15 to 26 years old who start the series later need three doses of vaccination. The doses are given again 6 months apart. People who are older than 26 years, the vaccination is not recommended for everyone older than age 26 years. Adults who age between 27 to 45 years of age, they should get HPV vaccine after speaking with their doctor about their risk for new HPV infection and the possible benefits of the vaccination for them. HPV vaccination in this age range is usually not recommended because it provides less benefit, and more people in this age range have already been exposed to HPV. People with a weakened immune system, they should get three doses of vaccine if they are 9 to 26 years old. January is generally celebrated as the Cervical Cancer Awareness Month worldwide. As it has already passed, but still we need to focus on the consequences, and we should encourage the screening programs for cervical cancer. So get informed, get screened, and get vaccinated. Cervical cancer again can be prevented and treated if caught early. The next cancer, which is common, is cancer, and it is the most common cancer with the incidence rate of about 12.4% worldwide. The most common cancers of cause of cancer of the death in 2022, accounting for about 1.8 million deaths. So for the risk factor of lung cancer, we know that smoking is the main risk factor. Along with, there are occupational hazard in the miners, heavy metal workers, secondhand smoke. If there is a family history of cancer, dietary factors, radon gases, aging, other illnesses such as COPDs or tuberculosis, pollution, and exposure to radiations. Sign and symptom. The most common presenting pictures of lung cancer is persistent cough, repeat or frequent chest infection, tiredness, chest pain, club fingers, shoulder pain, a lump in your neck, shortness of breath, coughing up blood, losing weight or loss of appetite, a cough that changes or gets worse, a hoarse voice or wheezing, back pain, and difficulty in swallowing. The diagnosis of breast lung cancer is mainly based on lung function test, bronchoscopy, CT guided biopsies, CT scan, which includes HRCT, MRI, and then PET-CT. The treatment modalities again for the lung cancers are surgery, which include the resection of tumor, chemotherapy, radiotherapy, immunotherapy, and targeted therapy. Prevention for the lung cancer is you need to quit smoking, avoid secondhand smoking, wear a mask to avoid air pollution, avoid workplace carcinogens, exercise regularly, and eat healthy. Screening. The lung cancer screening guidelines are recommended if you are 50 to 80 years of age, you are current or a former smoker in the last 15 years, or you have a 20-year pack history. A pack here is defined as smoking an average of one pack of cigarette per day for 1 year. For example, if a person could have a 20 pack year history by smoking one pack a day for 20 years or two packs a day for 10 years. The month of November is globally celebrated as Lung Cancer Awareness Month. So every breath count. We should make some efforts to reduce its incidence. Recent update. Current advances and future prospect in cancer immunotherapeutics. Immunotherapy has become a remarkable cancer treatment method with the development of CAR T cells and ICI, which are immune check in immunomodulators and cancer vaccines. In preclinical studies, it has been determined that the combination therapy of CAR T cells and ISI is effective on various malignancies and more effective than treatment use alone. What are CAR T cells? The CAR T cells are chimeric antigenic receptors T cell that have become a new form of as cell-based immunotherapy in which T cells from the cancer patient are genetically modified and are used to target tumors. With the recent development in genetic engineering, a chimeric receptor is expressed and cancer cells with potent anti-tumor effects are targeted. CAR T cell use therapy patients autologous T cell to generate tumor antigen-specific CAR ex vivo, and then this is infused into the patient back because of CD19 expression. Blood cancers are the most amenable disease group to occur in the future for CAR T cell therapy. High levels of tumor expression for the target antigen, the ease of assessing tumor cell via blood and lymphatics, and the tolerability of non-tumor effect of B cell aplasia on the target makes CD19 a good candidate for target therapy. So it's time for the multiple choice questions. In terms of the number of cancer-related deaths worldwide, the most common cancer is colorectal, skin, lung, breast, liver. C is the right answer, lung. Cancer screening is defined as search for unrecognized malignancy by means of rapidly applied test. For which of the following cancer, screening in only high-risk group is indicated? Options are breast and lung cancer, breast and cervical cancer, lung and liver cancer, cervical and lung cancer, liver, lung, and colorectal cancers. The answer is
I guess it's E.
E is the right answer. A 45-year-old female having a strong history of breast cancer and taking Depo-Provera injection intramuscularly for last 5 years visits her family physician for routine medical checkup. The patient is considered to be at high risk of breast cancer according to the new guidelines. At what age should she have get a mammography done yearly? Options are 35 years of age, 40, 45, 30, 32.
B option.
Yes, D is the right answer, 30 years of age. Cervical cancer is the fourth most common cancer in the women worldwide. Which of the following is the recommended screening methods for cervical cancer in women aged 30 to 65 according to the most guidelines? That options are pap smear every 3 years, HPV testing every 3 years, pap smear combined with colposcopy every 5 years, pap smear combined with HPV testing every 5 years, and pap smear combined with HPV testing and colposcopy every 5 years.
D option.
Yes, D is the right answer. Pap smear combined with HPV testing every 5 years. A patient presented in pulmonology OPD with the complaints of blood-stained productive cough, shortness of breath, chest pain, and weight loss. Which of the following is not the criteria for lung cancer screening? That is age 50 to 80 years, passive or second-hand smoker for last 10 years, currently smoking, former smoker for 15 years, or 20-year pack history. The answer is B, passive or second-hand smoker for the last 10 years. Female breast cancer is the most commonly diagnosed cancer globally according to the Globocane 2022. Awareness campaign on high-risk factors and screening of high-risk groups should be encouraged. Which of the following is a non-modifiable risk factor for the breast cancer? The options are oral contraceptive pills, Depo-Provera, breastfeeding, obesity, and late menopause. Answer is E, late menopause. HPV vaccination is recommended for women for reproductive age. Which of the following is a known benefit of HPV vaccination in terms of cervical cancer prevention? It is only effective in women who are already HPV positive. It provides lifetime immunity against all HPV strains. It prevents the development of HPV related cervical precancers and cancers. It eliminates the need for regular pap smears. It prevents the recurrence of cervical cancer in women already diagnosed. The answer is C. Vaccination against HPV can prevent from cervical cancer. What is the recommended number of doses for the HPV vaccine in individuals which are between the age of 9 to 14 years? One dose, two doses with a booster, three doses, and four doses. The answer is B, two doses. Which of the following type of cancer registries is typically responsible for tracking cancer cases with a specific region or country? A population-based cancer registry, hospital-based cancer registry, international cancer registries, private cancer registries, or special cancer registry? The answer is A, population-based cancer registry. A 56-year-old female comes to OPD with a complaint of right breast lump and nipple discharge. Patient is nulliparous as in a strong family history of breast cancer. Which of the following is the most specific and sensitive test to detect the breast cancer? Options are FNAC, mammography, breast self-examination, breast and axillary ultrasound, and CT scans. The answer is B, mammography. This is the key to the MCQs. This is the link of the YouTube channel where all the presentations are uploaded. These are my references. Thank you.